Opo. Panghuli na lang po, ano na lang daw po yung commitment ng DBM kaugnay sa paglalaan po ng pondo para sa calamity assistance ng mga sinalanta ng nagdaang bagyo at ng pandemya.
Kaya nga sabi ko kanina, yung paggamit kasi ng Calamity Fund or NDREAM-F, meron proseso yan. So, noong nagkaroon ng Odette, bali, muna natin, prioritize ni Pangulo yung pangangailangan ng Odette kasi immediate yun, Pero hindi ibig sabihin yung mga nasalanta, yung mga damage, naabot dahil sa Ulysses, Endong, at saka kung ano-ano pang bagyo. Hindi naman ibig sabihin kinalimutan natin yun o hindi nabibigyan. Ang mangyayari niyan kasi, meron mga ahensya na pwedeng gamitin yung kanilang sariling budget, lalo na kung repairs yan or mga livelihood. Pangalawa, pwede pa rin i-charge yan dun sa 2022 budget. Kung hindi ako nagkakamali, mga 20 billion yata ang alokasyon natin para sa calamity fund for next year, unless na-reduce yun ng Congress. Pero parang ganun ang amount.
Opo. Secretary, kami po ay nagpapasalamat sa inyong impormasyon at sa inyong panahon. DBM Acting Secretary Tina Canda. Happy New Year po, Secretary.
Happy New Year then, Yusek. Thank you. Thank you very much.
Samantala, base po sa talaang inilabas ng Department of Health kahapon, natagdagan ng 433 new cases sa mga nahawahan ng COVID-19 sa Pilipinas. Kaya po umabot na yan sa 2,838,640 total cases. 283 naman po nadagdag sa mga gumaling, kaya nasa 2,777,980 na ang kabuang bilang ng mga COVID survivors sa bansa. Sa kabilang banda, 13 po ang naitalang nasawi. Total, meron na po tayong 51,200 na dami ng mga pumanaw sa sakit. Nasa 9,522 naman po ang active cases o sa bansa. Katumbas po ito ng 0.3% ng total cases sa kasalukuyan. Isa po ang bansang Israel sa mga nanguna sa buong mundo sa kanilang COVID-19 response. Sa katunayan, isa rin po sila sa mga nanguna sa pag-roll out ng pagbabakuna panlaban po sa virus at ngayon pinag-aaralan na rin po ng Israeli government ito pong pagtuturok ng ika-4 na dose ng COVID-19 vaccine. Alamin natin ang iba pang detalye tungkol dyan mula po kay Israel Ambassador to the Philippines, Ambassador Aylan Flos. Good morning, sir, and welcome to the program.
Good morning. Thank you very much for having me.
Ambassador, what do we know so far about the proposal to administer a 4th dose of vaccine to the vulnerable sector in Israel? Is this already underway or still under consideration?
It's still under consideration. There's going to be another meeting to discuss this on Wednesday this week. There are different opinions, so the Israeli Ministry of Health and there is a special team to analyze this, have not yet decided. As you know, we are executing the boosters, the 3rd dose, the 4th dose is still being considered.
Opo, but Ambassador, some Israeli health experts are saying excessive vaccination may cause immune system fatigue and may do more harm than good. What is the Israeli government's stand on this?
So it's not clear yet what's going to happen. As I said, the experts are analyzing giving the 4th dose, but not yet decided if they will do that. We feel until now the indications are that the vaccine each month the level of antibodies is going down, and this is why they have to they're considering the 4th dose again also after the 1st, 2nd, then after the 3rd, after the booster, every month the level of antibodies is going down. So the 4th booster is really being seriously considered, but as I said, there's not enough medical evidence on what will happen if we give the 4th booster. So it's still being analyzed, but it seems to me that this might be the direction.
Ambassador, may we know how is the vaccination rate in Israel as of now? How many received their primary doses and how many already got the booster or third shot?
Yes. The Israeli population is about 9.3 million citizens, less than 10% of the Philippines. Until now, about 6.5 million got the first dose. This includes children from 5 and above. About 6 million got the second dose, and about 4.2 million people have received also the booster. What we are seeing today is actually, I wouldn't say growing hesitancy, but people are not rushing now, especially not the younger generation, is not rushing to get vaccinated, and especially not for the booster. So we have less than 50% who got the booster until now.
Ambassador, do we have data as to how many Filipinos in Israel are already fully vaccinated?
Well, that's easy. All Filipinos in Israel are fully vaccinated. They got including the booster. It is freely available. There is no limitation. It is up to them. And since a lot of them are taking care of elderly people, and elderly people are the most vulnerable one and most protected ones. So, to the best of my knowledge, all Filipinos, caregivers, diplomats, and other Filipinos in Israel have been fully vaccinated, and there is no obstacle in receiving their vaccination. Just regarding the Omicron, I would like to emphasize that the situation in Israel is that the numbers are growing. One person has passed away, but he had also some medical preconditions. He was not a healthy person. Today we have 1,118 positive confirmed to Omicron. Out of those, 723 are people who came from abroad who entered Israel. We have another 861 suspicious cases where we believe that it might be Omicron, but we are still doing the sequencing to identify if it is really the Omicron. And for that reason, we have also the protocols in Israel are being a little bit more strict.
Ambassador, how this one known death alarmed the government, and what other precautions were put in place in response to the Omicron threat, apart from administering a fourth dose?
So I would say the most important one is really considering the fourth dose and increasing the level of the number of people getting the third dose. The one person, as I said, who passed away, he had also other medical conditions, so it is not alarming. However, the numbers are growing, and if the numbers are growing, it means that there will be also more people hospitalized and more people in serious conditions. So for that reason, we have to take precautions, and we are introducing more strict protocols on, for example, people coming from abroad. Israel is still closed for foreigners, but Israelis who are traveling and coming back are not allowed to travel now to what we call red countries, and about 70 red countries. Those who do come back have to go into a 2-week quarantine. If they are fully vaccinated, they can go into 1-week quarantine, 7 days, together with a PCR test at the beginning as they enter the country, and another PCR after 7 days. We are also strict with the green tag. Anybody who wants to enter into a shop or into shopping malls has to be either vaccinated or tested and a negative test. People who are not vaccinated are able to enter shops that are supply essential goods such as food and pharmacies to buy medicines. So we're introducing more strict regulations now in order to deal with the Omicron.
But Ambassador, what are your thoughts on the restrictions that are currently in place here in the Philippines to prevent the Omicron spread? Is it somehow at par to the ones in place in Israel?
Well, I'm not an expert, so the condition in each country are very different. So I feel that the situation in the Philippines is good. I can see the numbers, which are still which are extremely low, which is very promising. And I see in general the people are obedient, so I feel quite comfortable. But again, I'm not an expert, so I cannot give you an expert advice on how the government here is responding. But it seems that they're also looking on what is happening globally and taking good care of the health situation here in the Philippines.
Ambassador, there were reports that this new surge caused by Omicron variant may once again overwhelm hospitals in Israel. How is the government preparing for the worst?
Well, the Israeli hospitals are well equipped by now and are quite ready to deal with the surge of patients. But again, I think the main challenge is to make sure that they're not overwhelmed and that they are not getting up to more than 100% of the capacity. And this is why we are introducing more strict regulation in order to keep as much as possible the numbers low. But when we see what is happening in other countries and you see the numbers, it seems that this might also be the case in Israel. As I said, we're trying to control them as much as possible and spread it on a longer time, plus vaccination, plus one more thing is much more testing and sequencing. So hopefully with the others we'll avoid or we'll make sure that the hospitals can continue to function properly, but they are, as I said, are fully equipped. The teams are there. Hopefully we will not reach to such a situation.
Ambassador, Israel has been one of the forerunners in COVID-19 response, yet the surge of cases still happened because of the Omicron variant. What may be the cause of this surge? Did people relax in following protocols way too soon?
People in general, people are not really watching and seeing the numbers, and people are worried, and are expecting the government to do more. I have to add that also in the schools we have more strict rules. On the other hand, there is a sense of fatigue. It's a global issue. We are living in this pandemic for almost 2 years. So there's also fatigue in the Israeli public, but the leadership is giving very clear and strong messages. The challenge is to balance between closing down the economy or continuing letting the economy run within sort of living with the pandemic. So we are here trying to balance between two extremes in a way, or between the two extremes, and finding the golden way in maintaining the public health, and on the other hand, keeping the economy and society healthy from that aspect.
Ambassador, what can the Philippines possibly learn or pick up from the Omicron surge experience of Israel?
I think both countries were, in a way, the Omicron came in late. Although I think in Israel the numbers are higher. I know the numbers are higher than the Philippines. So we'll be happy to again share our experiences and also our regulation and how we are dealing with the situation. As we see today, the pandemic is global. We get different challenges and new surprises. If it was the Delta, now it is the Omicron. We have to learn from each other on our protocols, on our efforts, on our practices, and to see what can be adapted locally. Whatever we bring will help the countries to deal with it. So we are working as part of the global community, and it's important to have exchanges between countries. And as I said, Israel and the Philippines have had some exchanges, and I think we should continue that, sharing the experiences.
Ambassador, we would also like to take this opportunity to thank the Israeli government for sending over assistance to the typhoon victims in the south. What more assistance will the embassy and the government provide in the next coming weeks, if any, Ambassador?
So we sent immediate response. We prepared and we immediately responded. We sent some food, hygiene kits, rice, solar panels to create energy, water purification systems to Cebu, to Bohol, and to Shiragao. This was very important for us to show the sympathy and the close relations, and we care about the Philippines and what is happening here. We are now looking how to continue for the longer run. We are going to continue working on the medical side, working with hospitals here in rebuilding some of the medical facilities that were affected, and quite a few. Now we are in discussions with the government here what should be longer-term response. I have to say that the Israeli embassy is also we're in touch with the Israeli civil society, which has already seen the devastation, and they're also joining the efforts, and already some Israeli NGOs that have started working here, and they will stay here also for the long run, and we are supporting them, and we're doing this in coordination between us as the embassy and the Israeli government and the Israeli NGOs and civil society. So we'll be here to stay.
Lastly, Ambassador, your message please to our viewers and to the Filipino people.
Well, we are living in a challenging time. It's a global world, global challenges, where we have the COVID-19, the Omicron coming now, on the same time dealing with the Super Typhoon Odette. So it is challenging times, but on the other hand, the Filipino people are extremely resilient and happy people and strong. And my message to you, to the Philippine government and Philippine people is that keep the spirit, keep strong. We still might have challenging times in front of us. I hope and pray that next year will be, from that aspect, a better year. Israel is a partner, is a friend of the Philippines. The Israeli people are friends of the Philippine people, and we'll continue with this partnership and friendship and work together for hopefully a better 2022 for all of us together.
Thank you for joining us today, Israel Ambassador to the Philippines, Ambassador Ilan Flos.
Thank you for having me.
Samantala, last week hanggang next week, asahan na po ang mga pagtitipon ng mga magkakapamilya at magkakaibigan dahil sa holiday break. Pero ang paalala ng mga eksperto, sumunod pa rin sa health protocols, lalo't ngayon pa lang po ay kinakikitaan ng bahagyang pagtaas ng Okta Research ang COVID-19 reproduction rate dito sa Pilipinas. Alamin po natin ang detalyeng niya mula po kay Dr. Guido David. Maganda umaga po, Dr. David, and welcome back po sa Laging Handa.
Yes, magandang umaga, Yusek, Rocky, and belated Merry Christmas sa inyo and Happy Holidays.
Yes. Doc Guido, gaano po kalaki yung itinaas itong reproduction rate natin ngayong kumpara po doon sa reproduction rate ng bansa pagpasok pa lang po ng December?
Well, nung early December, Yusek, nasa 0.33. Yun yung pinakamababang reproduction rate na nakita natin sa NCR. Pero sa ngayon, nasa 0.85 na siya. In fact, last week, nasa 0.44 siya. So parang halos dumoble siya kumpara sa last week. Ang magandang, hindi naman magandang balita, pero we have to put it in context na sa ngayon, less than 1 pa rin naman yung reproduction number. Yun naman yung mahalaga eh. So hindi pa naman talagang talagang pagtaas ng bilang ng kaso yung nakikita natin. Or what I mean is yung trending, hindi pa talagang solid na trending pataas.
Opo. Doc Guido, may tanong po ang ating kasamahan sa media. Ano po tanong sa inyo ni Lay Alvis ng GMA News? Ano po yung basa daw ng Okta Research sa pagtaas ng daily cases ADAR, reproduction number, positivity rate sa NCR. May indikasyon bang Omicron na driven na ito?
Tama si Lay Alvis na tumaas yung reproduction number, nasabi nga natin 0.85. Yung ADAR natin sa NCR ay less than 1 pa rin naman, nasa 0.82. So basta less than 1 yung ADAR, okay pa rin naman siya. At yung positivity rate natin tumaas din, nasa 1.4%. Medyo tumataas ng bahagya. Ngayon, ito pag ikumpara natin sa nakaraan na holiday season noong 2020, December, nagkaroon din tayo ng holiday uptick. So hindi natin masasabi ngayon na Omicron driven ito dahil nakita rin naman natin ito last year. Siguro doon sa mga pagtitipon-tipon ng mga kababayan din natin, kaya kailangan doble pag-iingat lang naman din ang kinakailangan natin. Sa ngayon, hindi pa natin masasabi kung may factor yung Omicron, pero ang sinasabi lang natin ay base sa nakaraan na taon ay may nakita rin naman tayong holiday uptick.
Opo, tanong pa rin po ni Lay Alvis ng GMA News, dahil po sa posibleng reduced testing ngayong holiday season, maaari bang mas marami pa ang actual cases at sa January na natin makikita yung real picture?
Well, tama rin yung sinasabi again ni Lay Alvis na reduce yung testing natin, at nangyari din yan last year na during the holidays may mga laboratories na sarado, kaya mas mababa yung testing output natin. At ngayon, hindi lang dahil sa holidays, dahil din sa recent typhoon, yung mga affected areas, mas mababa din yung testing nila dahil may mga laboratories na affected din. So dahil dito, hindi natin pa nakikita yung complete picture. Ganun din nangyari last year. Naghintay tayo hanggang mga first week of January bago natin nakita yung clear picture. Ang nangyari naman ng January this year lang, ng January of 2021, yung uptick ay bumalik na siya sa normal level. So bumaba ulit siya. Yun yung sana ang gusto nating makita ngayon, na after January, pag na-resolve ng testing, yung kakulangan natin sa testing at yung mga closed laboratories, ay bababa ulit sa normal levels ang bilang ng kaso. Yan yung gusto nating mangyari.
Opo, ito naman po ang tanong na ito mula kay Laila Salaveria ng Inquirer. Does Octa see a reason to tighten restrictions given the increasing reproduction number? Would it recommend a higher alert level in January?
There's no need to increase restrictions at this time because connected ito sa sagot ko kay Lay Alvis na it could just be a holiday uptick, which means na after the holidays, possibly bababa din yung number of cases and yung positivity rate. Pero sa ngayon kasi, hindi pa tayo pwedeng gumawa ng premature na intervention kasi hindi pa kompletong nakikita natin na larawan. Pero at the same time, magandang reminder na rin sa mga kababayan natin na patuloy pag-iingat at pagsunod sa minimum public health standards, pagsuot ng face mask, and magpabakuna yung mga hindi pa bakunado.
Opo. Katanungan naman po ni Laila Salaveria ng Inquirer, pati na rin po ng tanong ni Evelyn Quiroz ng Filipino Mirror, should we be alarmed by the recent increase?
In a way, USEC medyo expected ngayong uptick eh. Bakit expected? Kasi last year nangyari din yan eh, at due to the holidays. Kaya nga yung mga government agencies natin, yung mga local governments, in Department of Health, nag-issue talaga sila lagi ng warning na even as we enjoy the holidays, let's continue to practice minimum public health standards para maiwasan itong mga upticks na ito. So sa ngayon, hindi pa natin masasabing alarming, pero let's wait for more data. Siguro by January, we can reassess kung ano yung nangyayari sa pandemic situation natin.
Opo. Tanong naman po ni Caroline Bongkin ng CNN Philippines, kailangan na po bang i-flag ang nakitang pagtaas ng daily cases at ADAR sa NCR? Ito na po ba ang simula muli ng pagtaas ng kaso?
Unfortunately, sa ngayon, hindi pa natin nakikita yung totoong trend. So we'll have to wait until January. Kung tumataas pa rin sa January, then we have to reassess yung situation, USEC. Pero kung tulad ng sinabi natin, temporary uptick lang naman yan dahil sa holidays, dahil sa pagtitipon-tipon. Kung bumaba din yan by January, then wala namang cause for panic talaga. Ibig sabihin, mawawala rin pala siya. Last year, ganun rin yung nangyari.
Opo, pero Doc Guido, hindi pa po tapos itong holidays. Ibig sabihin po ba, posible talagang mas tumaas pa yan hanggang sa January?
Well, we cannot rule out that possibility, Yusek, sa ngayon. Again, incomplete pa yung, hindi pa kumpleto yung larawan na tinitingnan natin. Let's hope for the best. In the meantime, habang hindi pa natin nakikita yung buong datos, sana yung mga kababayan natin, magtulong-tulungan tayo. Yes, hindi pa tapos yung holidays, pero hopefully, winding down na yung mga parties na sinigawa, yung mga social gathering, baka mas kaunti na lang. At pag sumunod naman tayo sa public health standards, matutulungan talaga nito na ma-control yung number of cases sa NCR at sa buong bansa.
Opo, sa breakdown naman daw po sa mga rehiyon, anong lugar yung kinakitaan ng may pinaka tumaas na reproduction rate, at dito po sa NCR kung saan karamihan ay bakunado na, tumaas rin po ba daw?
Well, actually, Yusek, sa NCR, yung may nakita tayong pagtaas ng reproduction number. Sa mga ibang regions, mababa pa kasi mga case numbers nila. So, hindi pa klaro, hindi pa natin masasabi talaga kung may pagtaas. Dahil pag nag-average sila mga less than 10 cases, napakababa nito. Kahit gumalaw ng konti, hindi natin masasabi talagang may increase until magkaroon ng increase na medyo mas malinaw na pagtaas ng bilang ng kaso. Unfortunately, dahil sa kakulangan sa testing, dahil sa recent typhoon, ay incomplete din yung larawan natin sa mga probinsya at sa mga affected areas ng typhoon. So, unfortunately, kailangan natin maghintay, Yusek, hanggang mga January siguro para makita natin yung complete picture kung ano nangyari dito sa mga ibang regions. Pero sa NCR, may nakita talaga tayong uptick sa pagtaas sa positivity rate.
Opo. Tanong naman po ni Red Mendoza ng Manila Times, comparable po ba ang pagtaas ng mga kaso ngayong period na ito sa parehong period last year? Tingin niyo po ba sumisipa ang pagiging complacent ng mga kababayan natin?
Well, doon sa pangalawang tanong, yes, tingin ko medyo nagiging complacent ng konti yung mga kababayan natin. At yung sabi ng mga iba namin kasama na doctors, na fellows ng Octa Research, ay may mga bagong kaso na nakuha doon nila sa social gathering, kaya sila nag-positive sa COVID. Kung ikukumpara natin last year, yung base number kasi last year mas mataas, ngayon mababa eh. So kahit na may konti na tayong pagtaas, we're still at low risk dito sa NCR. Siguro kung i-compare natin yung rate of increase, medyo mas mabilis ngayon. Pero yung overall numbers, mas maganda pa rin yung numbers natin ngayon kumpara sa last year.
Opo. Kailan po na daw lumabas yung holiday surge nung nakaraang taon? Posible bang makita rin natin ang epekto ng holiday surge by first week ng January pa lang?
Last year nangyari yung uptick before the Christmas holiday. Ngayon nakita natin around the Christmas holiday. So, posible nating, yung sinasabi nating January, ang sinasabi lang natin ay mas malinaw yung magiging larawan natin sa situation ng pandemic by January dahil mas kumpleto na yung testing natin at makikita natin kung nag-sustain yung trend na patuloy pa rin tumataas. Pero kung patuloy siyang nangyari sa January, hindi naman natin masasabing January surge nangyari. Posibleng nagsisimula na ngayon. Pero January natin, makukuha yung confirmation. Pero sa ngayon kasi, yun nga, it's too early to say kasi pwedeng bumaliktad naman or mag-reverse yung trend at by January, makikita natin mababa na yung bilang ng kaso, sasabihin natin, ay wala naman pala. It's just an uptick due to yung mga slightly due to complacency ng mga kababayan natin.
Opo. Ano daw po yung, in case lang po, ano daw po yung posibleng mangyari sakaling hindi mapigilan yung pagtaas ng reproduction rate ngayong holiday season?
Well, wag naman sana mangyari yan, Rocky, pero of course, kung makita nating
Oo nga.
patuloy na tumataas, we have to reassess yung situation natin. Ako personally, I don't think babalik tayo sa panahon na kailangan natin mag-lockdown dahil marami na tayong bakunado sa NCR and in many of the metropolitan areas, yung vaccination natin will help prevent us from getting severe COVID. Yan yung nakita natin sa mga datos sa ibang bansa. Maaaring makuha natin yung virus, pero hindi magiging severe at hindi tataas yung hospitalizations natin. So, protected pa rin yung mga hospitals natin. Yan yung inaasahan natin based on data na nakikita natin sa other countries. Kaya mahalaga rin na yung mga hindi pa bakunado ay magpabakuna at yung mga nagpabakuna na, kung eligible na sila for booster shots, ay magpa-booster na rin para madagdagan yung protection natin against severe infection. Again, yung hinahabol natin is protection from severe COVID na mahirapan tayong huminga. Pag nagkaroon tayo ng nakakuha tayo ng virus pero bakunado tayo at nakuha natin ay mild lang, hindi na tayo ma-hospitalize, hindi na ma-overwhelm yung hospitals natin.
Opo, kami po ay nagpapasalamat sa inyong impormasyon at panahon. Ingat po kayo, Dr. Guido David ng Octa Research. Happy New Year din po.
Happy New Year, Yusek. Maraming salamat.
Samantala, daang mga pasyente at benepisyaryo ng Malasakit Center sa Quezon Memorial Medical Center ang muling tumanggap ng ayuda mula sa pamahalaan at kay Senator Bongo. Ang detalye sa report na ito.
Hindi lubos maisip ni Jerome Morcilla ng Tanay Rizal kung saan kukuha ng panggastos sa operasyon ng kanilang bagong silang na sanggol.
Yung esophagus niya po, hindi po direkta sa tiyan, hindi po napupunta yung pagkain sa tiyan. Kailangan po siyang operahan.
Setyembre nitong taon nang buksan ang Malasakit Center sa Quirino Memorial Medical Center sa Quezon City kung saan isinugod ni Jerome ang kanilang supling. Kaya laking pasalamat niya dahil may Malasakit Center ng malalapitan sa ospital. Bumalik din ang outreach team ni Senador Go kamakailan sa ospital para mamahagi ng tulong sa lubos na nangangailangan tulad ni Jerome.
Maraming salamat po, Kuya Bong. Napakalaking tulong po nung ibinigay niyong cash assistance po. Magagamit na po namin yun sa pang-araw-araw po dito sa ospital.
Laking ginhawa rin para kay Melody Bunda, ang nanay ng contact tracer na naaksidente kamakailan. Dahil sa Malasakit Center, natulungan sila sa gastusin sa ospital.
Sa inyo po, Senator Bongo, maraming salamat po sa ginawa niyong ganitong Malasakit Center. Ang halaking halaga na po ito para sa mga taong bayan, lalo po sa aming mga may hirap, dahil talagang malaking tulong po itong Malasakit Center.
Abot sa 352 ng mga benepisyaryo ng QMMC ang tumanggap ng ayuda mula sa tanggapan ni Senador Bongo. Mayroong mga face mask, pagkain at vitamins habang ang DSWD ay nag-abot ng pinansyal na tulong sa kanila.
Nagpulong ngayong araw ang iba't ibang ahensya ng pamahalaan para po sa pinakahuling assessment sa pinsalang dala ng bagyong Odette sa lalawigan ng Cebu. Naroon po ang kasama naming si Eunice Samonte. Eunice?
Yes, Yusek Rocky, sa mga oras na ito ay pahirapin pa rin ang signal, kuryente, tubig dito sa Cebu. Pero sa ngayon, ginagawa na ng NDRMC Region 7 ang lahat ng katuwang ng ahensya ng gobyerno para agarang maibigay ang tulong sa mga pinakaapektado. Sa mga oras na ito ay tuloy-tuloy pa rin ang pagpasok ng mga datos dito sa Operation Center ng NDRMC Region 7. Present dito ang iba't ibang ahensya ng pamahalaan, kabilang na dyan ang DILG, DOE, DepEd, DSWD, PCG, Pag-asa, DICT, Armed Forces of the Philippines Joint Task Force Cebu, PNP, PRO7 at ang OWA. As of December 25, umabot na sa 255 ang bilang ng 7 kung saan 45 pa ang nawawala at nasa 3,009 naman ang naiulat na injured. Sa datos na iyon nakikita, pinakamarami ang nasawi sa Bohol na may 108 dead. Sa mga oras na ito ay nag-shift na ang operation mula sa search and rescue at sa search and retrieval operation ng OCD sa tulong ng AFP at ng PNP. Kabilang dito ang area ng Bohol, Cebu, Negros Oriental, Siquijor, Cebu City, Lapu-Lapu City at Mandaue City. Ayon kay Director Marlo Salazar, Ang chairperson ng NDRMC Region 7 umabot na sa 60,000 nagdaipamahagi na family food packs na nagpapatuloy naman sa mga oras na ito. At ayon nga sa DSWD, nasa 30.3 million worth of the Region 7, kabilang dyan ang mga food at non-food items. Pinaalalahanan din ni Director Marlo Salazar ang PNP na i-monitor ang mga LGU na namimigay ng relief goods ng pangalan ng politiko ang mga as of now, nasa mahigit 64,000 out of 0.1% sa buong pinag-utos na rin ng DND gasolina worth 1,000 pesos lang sa mga motor. Sa na posible nga magkaroon ng mga cases ng diarrhea dahil yan sa inom na tubig. Sa ngayon kasi wala pa rin kuryente ang mga water filling station powered by generators at lahat ay umaasa ngayon sa mga bottled water at tuloy-tuloy pa rin ang pagpasok ng datos dito yan sa Operation Center ng NDO 77 at iahatid natin yan sa inyo live mula dito sa Lapu-Lapu City. Eunice Monte para sa Bayan.
Maraming salamat sa iyong report, Eunice Samonte. Isa po ang Baguio Flower Festival o Panagbenga sa mga inaabangang mapaturista man at residente ng lungsod. Alamin natin yan kay Debbie Gasinga ng PTV Cordillera kung matutuloy ba pa ang pagdiriwang na ito sa Pebrero 2022.
Pagkatapos ng 2 taon na pagsuspende sa selebrasyon ng Baguio Flower Festival o Panagbanga, inaasahang matutuloy na ang pagdiriwang nito sa February 2022. Gayunman, hindi na umano gaganapin ang Grand Street Dance at Grand Float Parades na pangunahing highlights ng Panagbanga.
Titingnan muna natin kung ano yung development itong Omicron. Pag nakita natin na medyo favorable siya, then that's the time that we will make all the official announcement kung ano yung mga activities na ilalabas.
Tatalakayin pa ng lokal na pamahalaan at ng Baguio Flower Festival Foundation Incorporated ang mga pinal na aktibidad. Sakaling makapasok ang Omicron variant sa lungsod, matutuloy pa rin ang festival, ngunit lilimitahan ang mga aktibidad. Sa ngayon ay patuloy ang aktibong surveillance ng pamahalaang panlungsod sa naturang variant kung saan nagsasagawa pa rin sila ng COVID-19 testing sa lahat ng close contacts ng mga nagpopositibo sa COVID-19. Debbie Kasingan para sa Bayan.
Alamin naman natin ang latest sa Davao Region. May report ang aming kasamang si Hannah Salcedo.
Para makatulong sa mga nasalanta ni Bagyong Odette sa maraming lugar sa Visayas at Mindanao, mayroon ng donate option ng Safe Davao QR para sa Pahalipay Christmas Package. Ang grocery packs na binibigay ng Davao City LGU sa mga Dabuenyong may QR code na 18 years old pataas. Ito'y matapos dinggin ng lokal na pamahalaan ang mungkahe na lagyan ng donate option ng Safe DQR upang maibahagi sa mga higit na nangangailangan ngayon ang regalo mula sa LGU. Dahil dito marami na sa mga hindi pa nakakakuha ng kanilang Christmas package ang nagdesisyon na i-donate na lang ito. Laman ng grocery package ang 2 kilong bigas, canned goods, pasta at spaghetti sauce. Samantala, una na ring nagpadala ng tubig at food packs ang Davao City LGU sa mga lugar na higit na naapektuhan ni Bagyong Odette. Nasa higit 100 personnel din mula sa lungsod na kinabibilangan ng mga doktor, social workers at rescue personnel ang rumisponde sa Bohol. Mula rito sa Davao City, Hannah Salcedo para sa Bayan.
Maraming salamat po sa ating mga partner agency para sa kanilang suporta sa ating programa at maging ang kapisanan ng mga broadcaster ng Pilipinas o KBP. At dito na po nagtatapos ang ating programa sa araw na ito. Hanggang bukas pong muli, ako po si Yusek Rocky Ignacio at ito ang Public Briefing Hashtag Laging Handa PH.
Kaya natin to, kaya natin to.